Okay guys, we're going to start this foam rolling routine with some thoracic rotations. I'm going to place the foam roller at my sports bra line, or just below the shoulder blades for you guys. And you're going to do 5 thoracic extensions. So notice I am cradling my head with my hands and I've got my elbows in really tight. I'm pulling my shoulders blades apart so that I can access those rhomboids in between the shoulder blades. So now I'm going to move it up to the middle of the shoulder blades. So I do 5 extensions at the bottom of the shoulder blades, the middle, 5 here. Make sure you're breathing. And then I'm going to be moving up to the top of the shoulder blades. Yep, last position here. Again, keep those elbows in tight. Keep your hips on the floor. You're trying to get as much extension in your back. We're just trying to open up that thoracic spine from all of our bad postures, sitting, driving, etc. Now I'm going to pick my hips up, keep my elbows in, and just massage and roll back and forth 10 times total. I'm going a little fast. I'd suggest going a little slower. You're trying to find any knots and massage them out. Now I'm going to open up my elbows so I can just hit my whole upper back. This is just one way of doing it. Usually I'll keep my elbows in and actually lean over to one side and hit on top of the shoulder blades one side at a time. But this is just an easy way to get it in quickly. Next we're going to move down to the hips. So sit on your left cheek, or one of them. Just sit on one cheek. And I'm going to use my feet and my hand to roll back and forth. Again, just doing 10 times. If you've got an area that needs extra attention, then you definitely want to spend more time on it. Hitting the other side. There's a lot of tools that you can use. I am using a rumble roller here, but you probably have just a regular 36-inch, maybe long, black foam roller or something of that nature, but there's a lot of different foam rolling tools. Next, we're going to hit the IT band, and this runs from the top of the hip down to the knee. So I'm showing you a version where I've got my top leg crossed over, so I'm going to take some of the pressure off using my top leg and foot and my hands. If you were to hit any knots in there, then you'd want to oscillate on them for about 30 seconds at least. That's what I'm doing here. And it's going to feel like, I call it a speed bump, where the roller is rolling and then you feel that bump or that sore spot, that tender spot. Sometimes it can send some pain down the leg. I actually just stacked my feet and went down to my elbow. This applies more pressure onto the IT band. So when you are ready for this, then you can do that version. So I'm going to switch to the other side. IT band can be a very common cause of knee pain because when that IT band gets tight, obviously it can't lengthen, and when you go to exercise, it causes pulling on the connective tissues around your knees. So you definitely want to hit these, and for most people when they start foam rolling, it's extremely painful. So I have been there. We all start somewhere, but the more you do it, the easier it gets. It should not hurt. That lets you know that there's definitely attention that needs to be given to that area if it hurts. All right, so next we're going to move on to the quads, and I'm going to need to reposition because I don't have enough room. Hitting my dogs who are behaving really well actually. So I'm going to start just above the knees and slowly roll up. Now usually I like to hit one quad at a time, especially on the rumble roller being so small. I'm not covering much surface area here, but it's fine if you want to do both legs at one time. Just try and relax your muscles as much as you can. So you should be focusing on relaxing deep breaths. This is actually a great way, if you're not too stressed out about it in the middle of it, to get into your parasympathetic nervous system, but I understand it's very stressful for some people when you first start. Now I'm hitting my hip flexors, so I'm going to put it in that crease, and I'm going to hit between the psoas, which runs toward the midline of the body, and then going out to the TFL at that hip bone. And I'm not counting, I'm just giving a good roll and kind of rocking from side to side nice and slow to try and get in there. It's a little harder with the larger foam roller. The smaller the apparatus, the better for these grooves and such, certain areas of the body. Next, we're going to hit the adductors, everybody's favorite one. And most of my clients do feel a little awkward at first. It's not the most attractive position. So just do it. Your body will thank you. That's what I tell them. Your body will thank you, because when these adductors get tight, they can cause a lot of problems. I mean, anything that gets tight is going to pull your hips out of alignment, and you're going to start to feel things usually in your back or your knees. So you want to take care of your body, keep it mobile, keep it supple. And I'm going to hit the other side. So I'm sorry I didn't tell you, but you're going to put that roller, if you couldn't really tell, at like a 45-degree angle. And then my body is face down, and then I'm taking my knee and turning that knee out, starting right inside the knee. There's a lot of trigger points there. So take your time on this one. Do not go fast. You're going to have to probably go really slow. Breathe. And just try to let yourself melt into that roller as much as you can, so that that tension can release. And again, we're still doing about 10 rolls, but there's certain areas that I definitely spend more time on, and go as slow as possible. And then I'm going to circle back up to the lats. Usually I hit these right after the thoracic spine, but I forgot. So now we're going to do what I call, actually not what I call, what I learned is called a reach and a roll. And I learned these from Dr. John Russin. So I've got my lower body balanced, and then find that uncomfortable spot. It won't be too hard on the lats, right below that armpit. And I'm going to reach up towards my bottom arm, and then just kind of like doing a rowing motion or a pulling motion and rocking back just a little bit. So rolling forward just a little bit. So we're just rolling side to side. I normally do like to roll these, but they are very uncomfortable for newer people. So usually I'll do a combination actually of this reach and roll, and then I'll pick my hips up and use my feet and massage it out a little bit. Just do the best you can. Some people, the reach and roll is actually pretty doable, but if you want to try and roll, then I would suggest maybe even just try lifting your body weight and putting pressure down and breathing and doing maybe more of an oscillating movement that's really small, just to, start trying the, more advanced versions. And the more you roll, the better your body's going to feel, the less it's going to hurt. I'd say if you were to foam roll at least 3 times a week, after 1 to 2 weeks, you're already going to be, not hating it and maybe even enjoying it. Most of my clients, after they adapt to it, sorry, we're going to move on to the calves and I'll finish that thought, but I'm going to hook one foot over on top of the other one and rock side to side. If you can't pick your body up, I'm kind of picking my body weight up and then inching my way down. You don't have to. You can keep your hips down and just kind of crawl like a snail on the floor and move yourself forward, because I know that this is kind of uncomfortable for some people. So yep, and now I'm going to just roll, massage up and down. Just put as much pressure down on the roller as you can. I like to kind of turn my foot in and out. Get into that Achilles. And then hit the other side. Again, I'm kind of pressing down with my top foot. You may not need much pressure if this is new to you. All these forgotten muscles that really don't get much attention. But you do get to control the pressure, but just put as much pressure as you can, especially when you hit those knots. I like to think, the more you can withstand the pain of a knot to work it out, the faster it will go away. And then there's some knots that you just can't get on your own. You're going to need professional help, a massage therapist or an ART specialist. So that's it. Thanks for joining me.